What is up, and welcome back to the channel. In today's video, we're answering all your questions from the Q&A. Let's get into it. What's up, guys? I'm Zach with Dr. Eyeball MD. Welcome back to the channel. If you are new to the channel, I am a second-year oculoplastic surgery fellow at UT Southwestern, Dallas, Texas. Going to graduate here in about 6 months or so. Pretty excited about that. But on the channel, we focus on everything about medicine, more specifically ophthalmology, even more specifically, for the most part, oculoplastic surgery, life in medicine, that kind of thing. If you're not already, go ahead, follow me on Instagram, Dr. Eyeball MD. Check out the podcast that my wife, who's also a physician, and I do about the harder, darker sides of medicine called On Call with Dr. Keenum. That comes out every week. And subscribe to the newsletter if you're not already. Anyways, let's get into the video. Let's answer your questions from the Instagram poll about ophthalmology, about medicine, that kind of thing. Let's get into it. Full disclaimer, I've not read any of these questions, so I don't have any pre-thought out responses to them, so everything will be kind of for the first time here. Are you happy about oculoplastics? Yes, definitely, of course. It makes you very niche, very subspecialized. It makes you a valuable asset. Where I'm going to practice in about 6 months, there's never been an ASOPers trained oculoplastic surgeon in the whole state that I know of ever. So that'll be cool. So it definitely gives you a cool niche skill. So yes, and I love the surgeries. I love it. It's a lot of breadth, a lot of different things we do. So yes, I love oculoplastics. Okay, next question. Is it possible to do an observership with you? I'm a med student interested in ophthalmology. Unfortunately, not specifically unless you are doing a rotation with the university or as a medical student coming specifically to the residency to observe. Then you could definitely hang out with me. Are you interested in teaching? Yes, I love teaching. That's why I have this channel, because I like educating about ophthalmology and medicine and kind of making your life a little bit easier if you're following along. How did you discover your passion for ophthalmology? I thought the surgeries were super cool. I thought the people were laid back and it was very chill. You sit down while you operate. Everybody was kind of easygoing. It wasn't hardcore cutthroat surgery like some of the other surgical subspecialties and just general surgery in medicine can be pretty much like that. So that's why I liked ophthalmology. There's a lot of videos on the channel about that too, by the way. What productive things to do as an MS4 with free time? Learn stocks, ? I don't recommend trying to learn how to play the stock market. That's not something that I think even some of the biggest hedge fund managers, can't outpace the market or outdo the market. So just put your money in an index fund if you're asking for my financial advice. But other productive things you can do, you can go ahead and start learning what you're going into. So if you're an MS4, presumably you've already got an idea of what you're going to go into. So I would go shadow and use your free time that you have in MS4 year to get as good at that as possible. So that would be what I would do. Dealing with difficult people, patients specifically. When you're dealing with difficult people and patients, it's important to just slow down and make sure you're listening to them, because the last thing that they want is for you to seem like you're not listening to what they're saying. So take the time to listen to what they're saying, even if it seems silly to you or doesn't make sense or is just not right medically. Just listen and hear them out, and then just calmly explain what you think, and that's all you can do. So don't lose your cool and keep your head about you, I think. What's the future scope in the field of ophthalmology? Is it truly saturated? No, it's not saturated. Like I said, I'm going to practice where I'm the only one of my type of people that is in many 100-mile radius. So although I'm going to a more rural area, but it's definitely not saturated. Obviously there's going to be more ophthalmologists in densely populated cities, but there's still a huge need for ophthalmologists. A lot of them are booked out for months, even in the big cities. So it's not saturated. It's still definitely a big need for physicians, I think. Someone just wrote cardiac surgery. I don't know what to say to that, but cool. Is general anesthesia typically used for operations, or can local blocks be placed? For ophthalmology, most of it can be done under topical anesthetic if you're talking about cataract surgery. So just drops of numbing eye drops on the eye is typically all you need for cataract surgery. Some of the bigger procedures, like some glaucoma surgeries, cornea surgeries, we may do more advanced blocks, like a subtenons block or a retrobulbar block. And then for bigger surgeries, like some in oculoplastic surgery, we'll actually do general anesthesia, or like an LMA or a full general anesthesia with intubation, that kind of thing. So yes, it spans the range, but for just your bread and butter cataract surgeries, most of it is under topical anesthesia. typically. And even a lot of oculoplastic surgeries can be done with just local anesthetic or MAC anesthesia. Any opportunities for IMG ophthalmologists in the U.S.? Yes, there are. It's obviously much more difficult just by the nature of it being a bit competitive to get into allopathic medical schools, and then to get into residency, it's harder, but I've worked with some. So yes, it can be done. Best advice for a med school applicant to stand out. Just the biggest problem I see with medical students that come on the rotation with us is a lack of focus and concentration and enthusiasm about what we're doing. You don't need to know a lot, obviously you're not going to, but seeming curious and being engaged is not hard to do, but for whatever reason a lot of medical students can't even do that. So that's the two things I would do, is be engaged and curious, and that's the easiest thing you can do to stand out, I think, as a medical student. How do you record your surgeries? So sometimes we'll use a GoPro, or sometimes we have kind of a boom arm set up with a nicer camera. We use a Sony A7 III with the big G Master 90mm lens for a lot of our surgeries that we're using for the surgical video atlas. If you were running an ophtho interest group, what kind of things would you do? I was the president of the ophtho interest group in med school, so I kind of took over that role. What I did was I brought people in to speak that knew more about ophthalmology, could tell about like a life in ophthalmology, and then organized some kind of teaching sessions with the residents at the program where I was, to kind of teach medical students and broaden the exposure of the medical students to ophthalmology. And I think that those are two important things you could do if you're running a group. How long did it take you to be a doctor? 4 years of med school, 4 years of med school after college, and then you're a doctor. Then 4 years of residency, 1 intern year, and then 3 ophtho years, 2 years of fellowship. So I'm 31, about to be 32, and then I'll be done with training at the age of 32. Is there any tip you could give to a new ophthalmology resident? I have a whole video on how to be successful as a new ophthalmology resident. Most of that focuses on making sure you make a switch, a little paradigm shift in your way of thinking about how to study, less for test and more for learning things that can be applied and are clinically relevant. So check out that video on the YouTube channel. What should I look for in choosing a good oculoplastic surgeon? So obviously experience is good, and then the nice thing about oculoplastic surgery is you can see a lot of the before and afters just by nature of the way the surgery is done. You can see before and afters, and that's, it's hard to fake those. So check out the before and afters, check out the scope of what they do, where they trained, who trained them, that kind of thing. Someone says, I'm missing an eye and want to become an ophthalmologist. Is it possible? Probably very difficult for you to get into an ophthalmology residency with only one eye, because you don't have any stereoscopic vision with only one eye. You don't have 3D vision, so it's harder to gauge depth, which is critical in eye surgery. So it would be very difficult. I'm never going to tell somebody that they can't do something or that it's impossible, because maybe there is a way, but it would be very difficult. And I'm not sure. I don't think where I train, at least, that you would get a residency spot if you're monocular, unfortunately. Kindly make a video showing how you record and edit your videos and photos. That's a good idea. I made a video like that on the YouTube channel a few years back, or a couple years back, but the setup has been upgraded ever since. We got a lot more going on here, so maybe I will update that one. How to choose a subspecialty. I also have a video on this, but one of the most important things that I've said before when you're trying to choose a subspecialty is figure out what you enjoy doing. What is the most fun specialty? So forget about the money to some extent and the lifestyle to some extent. So just don't think about those. Think about what is fun and what you enjoy doing, and then figure out that, and then come back and think about maybe the compensation and the lifestyle, and if it all fits. But don't forget to find out what you actually really, really like doing. So what's actually going to be enjoyable on a day-to-day basis. What should one value in fellowship? Hands-on with more surgeries, a good mentor. We definitely need to be hands-on with surgery, but the main thing in fellowship is to have an appropriate level of autonomy, which is the more the better, I think. So the more autonomy you can get in fellowship, the more comfortable you're going to be when you get out into practice, with actually doing the thing. So until you're kind of on your own and forced to make the decisions on your own, you really don't kind of take the ownership of being an attending. So autonomy is huge. Surgical volume is huge. Those are the two biggest things in my opinion. Someone asked about ENT for IMGs. I don't know. Sorry, not my field. Someone asked best scrubs. So that's a good question. I actually like these scrubs that I have. They're from they're called Revolution. I don't know what the actual brand is, but I like the looser fitting, kind of comfortable scrubs. The figs are good. How much of your time would you say you spend in the OR versus clinic? It's probably weighted a bit more toward the OR. I would say maybe 60% OR, 40% clinic if I had to guess. But you have to be in clinic enough to generate the volume to do the OR cases. So, how fitting is ophtho for someone looking for diverse surgical scenarios? So it depends on what you do within ophthalmology. If you do comprehensive ophthalmology, you'll primarily be doing cataract surgery unless you kind of do, you're more rural. Maybe you're doing some smaller plastics cases and glaucoma and cornea cases. But if you want diversity, doing something like oculoplastic surgery, there's a lot of diversity in terms of what we do surgically. But ophtho in general, if you're just going to do comprehensive, not necessarily the most diverse in terms of range of surgical procedures. Is working ever boring? I mean, on days where you see the same cases over and over again. I don't get very bored actually at work, especially in the OR. It's pretty stimulating, so that's why I like it, because I don't get bored, and I do get bored easily. Favorite surgery / procedure? I like lower blephs. They're finicky. There's a lot of ways to do them. There's a lot of nuance to them. It's much more complicated than upper blepharoplasty, so that's probably my favorite. Can a romantic relationship from college survive medical school? Yes, I got married to Rebecca. We've been together since 9th grade of high school, so it can survive high school, college, med school, residency, fellowship. So yes, it can. Wanting videos about all the oculoplastic surgeries from an ophthalmology resident. So yes, we have a whole library that I'm working on editing, and it's going to be all different types of oculoplastic surgeries. And I think it's going to be really good. It should be really in depth. The video is excellent. We'll do good narration. The surgical technique I think is really good. It's done by my mentor Ron Mancini. So yes, that's coming. You guys have a lot of great questions. We're going to keep going here. All right. So can someone be in a relationship marriage while studying and doing residency? Yes. Kind of answered that one just now. My good friend said, when will I get my t-shirt? So I actually designed some cool t-shirts called or what was it? It was Divide and Conquer, and it's like holding a phaco handpiece. If people were interested, I could make those available. Does the biopsy make cells more aggressive if they are cancerous? Not to my knowledge. What makes someone a good ophthalmologist? Probably what makes, so there's a few things to be good in ophthalmology. You need to be good at the ophthalmologic exam. You need to have the knowledge base to know what things can be from a diagnostic standpoint. And then there's this little thing called clinical reasoning that I don't know how easy that is to teach. It seems kind of more of an abstract thing, like the reasoning ability that goes into it. That's very important. I don't know how easy that is to teach. And then the third thing is, or the fourth thing I guess, is surgery. So being good at surgery, really a lot of it comes down to thinking out what you're doing and being intentional with what you're doing. So yes. That's pretty much it. Examples of ophtho research: we can initiate no support from community ophtho or home program. That's a tough one. You want to reach out and try to work with somebody. If you can do something remotely, maybe you could do some kind of like data review, or you could get access to the EMR at another program to do some kind of like chart review thing for another program. Maybe that would be the way to go about it. How can we stand out as medical students? We answered that one. What is the most important element of medicine? Probably listening is one, but I'll do two. Listening, and then a bit of humility and realizing that you can only do so much as a doctor, and you'll never be as good at healing the body as the body is itself, and a lot of times you just can't outdo nature. And so that realization is probably important in medicine, I think. Maintaining wellness as a surgeon. The biggest thing you can do, the two biggest things, are to work out and to sleep. If you can do those two things, I think it'll make a huge difference. Getting enough sleep, working out, it's hard to do that, but yeah, it's hard to do. How did you decide which fellowship you wanted to do? So I was about to just do comprehensive ophthalmology, and then last minute I decided I wanted to do oculoplastic surgery. I really liked oculoplastic surgery. I didn't think I would match into it, so I wasn't going to do it. Then I had some encouragement to apply, and I did match, so that's kind of how I got into it. But I really liked it, thought it was fun, so that's what initially prompted me to want to do it. UK medical student here, or medical person here, want to study ophthalmology, especially in the U.S. What are the steps needed? I would think you need to take your USMLE step 1, 2, and 3 boards to do that, and then apply for a residency spot would be my guess. I don't know all the steps in detail, but that would be what I would guess. I'm sorry. Anything about ptosis repair techniques, frontalis sling, frontalis flap, etc. So those types of repairs for ptosis are for things like congenital ptosis, or in the case where there's very poor levator function, where you want to link the eyelid to the frontalis muscle with like a flap or a sling. There's other types of ptosis repair. We've talked about those in a video on YouTube, the Forrest Whitaker video, where we explain ptosis, but there's things like muellerectomy, done from the back side of the eyelid, anterior approach levator resections or advancements. And then we have a new technique for ptosis repair that will be coming out probably in the next few months. And then I'll show you guys the video of that surgery once it comes out, the paper's published. Best way to learn around the eye, suturing and chalazion for beginners. So suturing on the eye is different from around the eye. So suturing on the eye, like corneal suturing, scleral suturing, conjunctival suturing, you need to practice under a scope. You should put gloves on when you do it if you can to get used to that. Then I have some videos about suturing around the eye, like closing eyelid lacerations, closing skin, that kind of thing. Typically you don't need a microscope for that. You might use loupes, the magnifying eyeglasses, but I have a video about suturing techniques that can help with that. So yeah, let's see. Oh, chalazion. You asked about chalazion. So I don't know. We will probably make a video on how to basically IND a chalazion. Best international exams of ophthalmology that can help in my career. I don't know what that means. I'm sorry. How can we get residency in ophthalmology? Or what are the exams that we need to apply for? Like I said, maybe the STEP exams would be the first step. Why did you choose oculoplastics over the other subspecialties? That's a good question. So I personally did not find glaucoma very interesting. I didn't find cornea that interesting either. I did think refractive surgery was cool. Pardon the plane in the background. I did like cataract surgery. I liked refractive, the idea of refractive surgery, although we didn't do much in residency. I liked cataract surgery. I thought retina surgery was cool, a bit tedious, and then I thought oculoplastics was just more fun as a surgical subspecialty. Advice for MS1, so first year medical student interested in ophthalmology. It's pretty early. We do have a MS1 working with us doing some research projects right now. But maybe just shadow, see if it's really what you want to do. It's a little early to kind of commit to a specialty as a first year med student, so I wouldn't commit that early, but kind of shadow and see, get a better idea of the specialty and what it entails on a day-to-day basis. What makes an IMG match into optho with ruling out USMLE scores? Thanks. I don't know, probably connections, unfortunately, but I don't know, to be honest with you. Tips to match in fellowship if residency is done outside the US. Yeah. All these are in the same vein. I don't know the answer to that. How to deal with tremor while operating. I know some people actually put betadine, or not betadine. We'll put timolol. I was thinking beta blocker. We'll put timolol drops under their tongue. Don't put betadine under your tongue. But some people put timolol drops under their tongue to help steady tremors and that kind of thing. I've never done it. I actually drink Monsters every morning before I operate, and it has no effect on me. So I don't know, but that would be one thing. And the other thing is to have intentional movements. Don't be thinking too much. Just have intentional, smooth movements if you can. Do you think that by going into ophthalmology, you forget everything you've learned? A large portion of it you do forget because you don't use it, and if you don't use it, you're going to lose it. But if you don't use it, you don't necessarily need it, I think, for the most part. So you do forget some things, but you don't forget the things you need because you're using them on a day-to-day basis. Is it possible to get into medical school in the United States, not having finished university in a non-EU country? I have no idea. I'm sorry. FICO preparations and materials. Don't know, you guys. What are the 3 adjectives you'd use to describe yourself? Right. Probably energetic, enthusiastic, and scattered would be the downside. A bit scattered. Is it possible to be successful as an ophthalmologist if choosing to be one but not do surgery at all? You could do it. You could do medical retina, something like that. I wouldn't go into ophthalmology if you don't want to do procedures and if you don't want to do surgery, because it's such a surgery and like procedural heavy field. I would probably consider something else. But if you really want to be an ophthalmologist but you don't want to do any of that, you might consider going into optometry. Would be another way to kind of do the medical side of ophthalmology without doing all the extra training and expense. But you certainly could. You could do medical retina, you could do uveitis or neuro-ophthalmology, that kind of thing. So yeah, you could do it. Have you considered opening your own practice after fellowship? Yes, that was actually my plan, was to open my own practice after fellowship, but then I ended up finding this like amazing practice, so I signed with them. But I considered it. I actually went pretty far down the rabbit hole. I was looking at medical real estate. I was looking at, EMRs. And so, yeah, I was going to open my own practice. So I know not an insignificant amount about the steps to go about doing that. So I could talk about that in a future video if people are interested. Can you talk a little bit about compensation in ophthalmic plastic surgery? A little, because I don't know. I don't know it so well because I have friends that have done it, and some told me, well, this is kind of ballpark of what you make. Some say this. I know some that make over $1 million. I know some that, in academics probably make in the 2 range or less. I think probably in the 3 to 4 range is more on par if I had to guess, but I really think it's so variable and depends a lot on how much cosmetics and cash pay procedures you're doing. Do you wish oculoplastics was a little less competitive and more people could join the specialty? That's a good question. It is kind of neat that it's like competitive and kind of like a club to get into, and it's kind of fun that way, but it certainly would be helpful if there were more spots, because then you could have more oculoplastic surgeons, but I probably wouldn't change it. I think it's kind of fun the way it is. Was it frustrating learning how to use slit lamp, indirect, etc. when starting residency? It was a bit frustrating. It's a bit nerve-wracking because you first start out trying to do it and you don't get it, and you're like, oh my god, maybe I can't be an ophthalmologist, or I'm not going to be able to do this. The first time I ever looked through like a teaching scope, I literally just saw like pink blob. I had no idea what we were looking at. I couldn't see anything. And I was like, oh my god, I'm never going to be able to do this. So yeah, it's nerve-wracking at first, but once you get it, and it's not a big deal. But I would try to learn it in medical school before residency if you can. When will be the next podcast? I'll have the book recommendations. Oh, that's sweet. We'll have a podcast out tomorrow, hopefully, if we can get it recorded tonight. Yeah, check out the podcast, guys, if you haven't. We do some book recommendations on that, and the newsletter always has a book recommendation. TED diagnosis and management. So TED, thyroid eye disease. There's a constellation of symptoms. You can Google Graves' thyroid eye disease, and that's kind of what it looks like for the most part. It can be kind of on a spectrum. It is on a spectrum often. And it can be kind of a subtle diagnosis sometimes, but then you can do things, surgical management with decompressions, strabismus surgery, lid surgery for retraction repair, that kind of thing. And then medical treatment with this new drug called Tepezza, which is pretty good. Is your workload as an oculoplastics fellow varied, like daily surgical challenges? Yes, it is varied. I'm in a different place almost every half day. Sometimes I change places more often than that. And then what I'm doing, maybe clinic in one half day, surgery in another. I may be doing peds in the morning and then adults in the afternoon. So it is very varied in oculoplastic surgery, which keeps it interesting. Last question, can you choose to do more surgery than clinic as an ophthalmologist? You can do whatever you want as an ophthalmologist. You could do more clinic, certainly. There's only so much, if you want to lean toward the surgery side, there's only so much you can do before you have to go back to clinic and generate more surgical volume, but there will always be clinic for you to do, that's for sure, as an ophthalmologist. So I hope that helps. Guys, I hope you enjoyed this video. We kind of sped through all those questions because there were so many. If you want me to touch on one in more depth, comment down below and we can do that. Hope you guys like this video. Sorry I've been away for a little while. It's been some tough things in fellowship. But anyways, I hope you guys enjoyed it. I'm Zach with Dr. Eyeball MD. I'll see you guys in the next one.